Hello everyone, my name is Abby Lone Wolf and the topic that I chose for my EMS capstone presentation is bleeding and shock. I have experienced a couple of calls in my career in EMS that involved severe bleeding. Some were stab wounds to the carotid, a gunshot wound to the femoral. I had a patient with an open dialysis access site that she bled from. Also, I've seen patients vomit bright red blood. And if I could sum these kind of calls up in one word, I would say terrifying. They are a true emergency. So I took for my presentation some of the basic information from bleeding and shock because you could really spend hours or days on the subject. But in order to fit it in the time allotted for this assignment, I just took some basic components. So let's get started. So if you get a call to a house and you see this when you arrive, do you think that this person could survive? We will revisit this at the end of the lecture. So the goal for this lesson is that you will be able to describe the circulatory system and the different types, characteristics, causes, and management of bleeding and shock. These are the objectives. You will be able to state the proper function of the three main components of the circulatory system, identify the three major types of blood vessels by their functions within the body, describe the characteristics of the three main types of bleeding by color, flow, and pressure, demonstrate knowledge of the approximate blood volumes for a newborn child and adult, differentiate between external and internal bleeding, citing at least 3 examples of mechanisms of injury for each, list and perform the steps for controlling external and internal bleeding on a standardized patient, define shock and correctly match 3 different causes to 3 different types, correctly classify patients as either being in compensated or decompensated shock. Describe the signs and symptoms of a patient in suspected shock in the correct order they would occur. And list the steps of managing shock in the field and indicate when immediate transport is needed. Okay, so the circulatory system, it is responsible for the distribution of blood to all parts of the body. There are 3 main components: the heart, the blood vessels, and the blood. You may have heard these referred to as the pump, the pipes, and the fluid. The heart is the pump. It is the muscular organ settled beneath the sternum. It pumps blood, which supplies O2 and nutrients to the body cells. The blood vessels are the pipes, and there are 3 major types. Arteries, which carry oxygen-rich blood away from the heart. There are veins, which carry blood depleted of oxygen and loaded with carbon dioxide back to the heart, and capillaries, where the oxygen, carbon dioxide, and nutrient waste exchange with the body cells takes place. And then there is the blood, which is the fluid, and it is responsible for the transportation of gases, nutrition, excretion, protection, and regulation. So these 3 components, the heart, the blood vessels, and the blood, they must function properly for the circulatory system as a whole to function properly. Now let's talk about bleeding. It is the major cause of shock in trauma. You may have heard of bleeding referred to as hemorrhage, which is severe bleeding, or exsanguination, which is also severe bleeding, severe blood loss, colloquially known as bleeding out. There are 3 main types of bleeding: arterial, venous, and capillary. Arterial bleeding is bright red in color, spurting, a pulsating flow. Arteries are under a great deal of pressure. They have a thick muscular wall. Venous bleeding is dark red in color. It has a steady, slow flow. veins have one-way valves in them. They are under less pressure. And capillaries are also dark red. There is a slow ooze to the blood flow, and it's under very low pressure. So blood volume, it depends on your weight, sex, and where you live. Females tend to have less blood than males, and if you live at higher altitudes, you'll have more oxygen, or excuse me, you'll have more blood because there is less oxygen at higher altitudes. An average adult weighing about 150 to 180 pounds has approximately 1.2 to 1.5 gallons of blood. And these are some examples. A 9-pound newborn will have less than a 12-ounce can of soda's worth of blood in their bodies, or about 355 milliliters. A 60-pound child will have an approximately 1 2-liter bottle, and a 125-pound adult will have approximately 2 2-liter bottles. So if you can picture these amounts in terms of soda bottles or cans or gallons of water, then you can kind of imagine how much blood a person has. So for you visual learners, this is kind of what it looks like. So now we're going to watch a video, an exercise that many of you probably did in your EMT classes. Going to pour a little bit of fake blood on the floor so you can kind of see what a certain amount of blood looks like when it's out of somebody's body.
Someone can lose by what it looks like on the ground. And a standard IV bag is about 1,000 milliliters. So we've got maybe 700 in here.
Yeah, watch your shoes, it'll splatter. Go down lower. There you go. Yep.
So as you can see, that's quite a bit of blood. Okay.
So bleeding, there are two types, external and internal. External bleeding occurs outside the body. A force penetrates the skin and lacerates or destroys underlying blood vessels. Some things that can cause external bleeding: gunshot wounds, stab wounds, open dialysis access site, like I mentioned earlier. Internal bleeding occurs inside the body, and pay attention to the mechanism of injury because you won't always see obvious injuries, but due to a blunt trauma such as a fall, MVC, auto pedestrian collisions, blast injuries, they may have some internal injuries from that mechanism of injury. Also penetrating trauma, again, the gunshot wounds, stab wounds, impaled objects, they can damage internal organs as well and cause internal bleeding as well as external. Controlling bleeding, it is the most important element in the prevention and management of shock. Take immediate steps to correct and/or control life-threatening bleeding before you perform any other assessments or treatments, because if you don't get control of that bleeding, then anything else you do is pointless. For external bleeding, as always, scene safety BSI, especially when there is a lot of blood. You want gloves, a mask, goggles, gown, you want the works. Put direct pressure immediately over the injury. And I still tell people elevation of a limb is something that you can do while you're providing direct pressure. It's not going to hurt the patient. Scientific studies say it doesn't really do much, but it doesn't hurt either. And if you can't get control of the bleeding with direct pressure, you need to apply a tourniquet. And that'll be 2 inches above the injury. And you want to crank the tourniquet to make sure that the blood stops flowing, and you'll record the time and then prompt transport. Internal bleeding, scene safety, BSI, at least gloves. The ABCs control external bleeding. Of course, if you see a massive amount of blood loss going on, you want to control the external bleeding before you do anything else. If you've got good partners, good help, a lot of help there. ABCs can happen simultaneously. Administer O2, apply splint if necessary, preserve body temp, and prompt transport. And now I'm going to show you a video of controlling bleeding. We kind of rigged up an IV bag with some red food coloring to try to show you what an arterial bleed might look like. My coworker Marlene that helped me with this, she was a little sensitive, so I didn't want to put as much pressure as you're supposed to put, and I didn't crank on the tourniquet like you're supposed to because I didn't want to hurt her. But just so you get an idea of what it might look like, what the blood loss on the floor might look like, and what your interventions might look like. So let's watch that.
Good.
It's not red, it's white.
There it goes.
Okay, when you see something like this, you want to make sure that you have the seam is safe and that you have your VSI on. And right, you want to get pressure on it. So hold with the palm of your hand, gloved hand. You're going to have your partner help you, and they're going to help put on a pressure dressing.
Am I gonna die?
Well, we're going to try to make sure you don't. So you can see that the blood is still coming out. Make sure that you got good pressure on it. And you would secure this. Blood is still coming out. You're going to keep holding pressure though. But this is just for demonstration purposes. You put a tourniquet on. Your partner's still helping you hold pressure. If the patient can't elevate, that won't hurt either. 2 inches above the wound. And you're going to want to tighten this. I won't do it too tight for my patient. And there's even a spot here we could write down the time.
How you feeling?
I feel numb. I don't wanna die.
Are you good?
Yeah.
Okay.
I don't know to that.
And there it is. If you don't get control of the bleeding, it will lead to shock, which is our next subject. Also called hypoperfusion. It is the body's reaction to decreased blood circulation to the organ systems. It is the result of inadequate perfusion of tissues with oxygen and nutrients and inadequate removal of metabolic waste products. If untreated, shock will cause cell and organ malfunction and ultimately death. Shock may develop if the heart fails as a pump, blood volume is lost, or the blood vessels dilate. There are 2 categories of severity with shock. The first is compensated. That is when the patient is developing shock, but their body is still able to maintain perfusion. You'll see an increase in heart rate and respirations with these patients. Also constriction of peripheral circulation, which causes the pale, cool skin. And the other level of severity is decompensated. This is when the body can no longer compensate for low blood volume or lack of perfusion. Falling blood pressure is a late sign of this. There are 3 types of shock. One is hypovolemic or hemorrhagic. It is caused by uncontrolled bleeding, either internally, externally, or both. Cardiogenic shock is the inadequate pumping of blood by the heart, and that can be caused by MI, heart failure. Patients can be in cardiogenic shock with heart problems. Neurogenic shock is the uncontrolled dilation of blood vessels from nerve paralysis caused by spinal cord injuries. There is no actual blood loss with neurogenic shock, but the dilation of the blood vessels increases the circulatory system's capacity to the point where the available blood can no longer adequately fill it. That is not real common in the field. Signs and symptoms of shock: the patient will have an altered mental status, behavioral changes. Usually the family, they notice this right away, that the patient's not acting right. They'll have pale, cool, and clammy skin. And because the blood is being shunted to the more important organs, such as the heart, the brain, and the lungs, and not going to the digestive system, you'll see nausea and vomiting with the patient. Also, vital sign changes, that increase in heart rate, increase in respirations, and toward the end, late sign of dropping blood pressure. Some other late signs are thirst, dilated pupils, and cyanosis around the lips and the nail beds. So when managing shock, as always, our scene safety and BSI, ABCs and control any external bleeding. Some of these things need to be going on simultaneously. You definitely want to get control of any severe external bleeding before you do anything else. Splint as necessary, prevent loss of body heat, and immediate transport. Now remember, transport is actually an intervention that you can provide for patients with severe bleeding and shock, because these are such dire emergencies that transport is an actual intervention, something that you can do for the patient to help them. So in closing, the circulatory system is a closed system consisting of the heart, the blood vessels, and the blood. When one or more of these components is compromised, whether externally or internally, severe uncontrolled bleeding can occur, and that will eventually lead to shock, ultimately causing death. With the proper management of bleeding and shock, the patient has a greater chance of survival. So back to our scenario in the beginning, knowing what you know now, do you think that this patient could survive? And the answer is no. This is a lot of blood for one person to lose. Are there any questions? Thank you.